Welcome to Towerwood Vets. This is an informative video to allay fears of what happens to your pet when they come in for an operation. Today here's Oscar. He's coming in for a minor operation. We'll follow him through the day. He will have had no food from 8 o'clock the night before to make sure that his stomach is not full. We do ask that the pets are taken for a walk or allowed to go to the toilet before they come in. We don't restrict water until the morning of the operation to enable them to stay hydrated. When they come in, there will be some forms to sign to say that you understand the minor procedure that they're going through and that you're happy with what that's going to entail and that we have your contact details. It is really important that we are able to phone you when they recover so that you know when to come and collect them. Once Oscar is admitted, we have a procedure where we will listen to his heart, make sure that nothing has changed since the last time we've seen him and that he's in full health from a clinical aspect for his procedure. We make sure they have an up-to-date weight so that we can make sure the dosages are correct of the anaesthetics that we're going to use. Oscar comes into the dog kennels. These are kept separate from the cat ward so that there is no increased stress to either species. The dog kennels is a nice environment. We have pheromones placed in there to reduce stress levels, and Oscar you'll see in one of the walk-in kennels which has plenty of room for him to move around. He will have an intravenous catheter placed which enables us to control his anaesthesia on induction. Following this, he will have a sedative which enables us to relax Oscar so he is not stressed when he goes through for the procedure. Some animals will have had an anaesthetic blood test taken which allows us to assess what is happening with their organ function and their cell counts. This may be done in older patients especially, and although it may not stop the procedure, it may enable us to change post-operative treatments to make sure that organ function is maintained for the longer term. When we're ready for Oscar's procedure, we will bring him through from the kennel area into prep. This is an area where we induce the anaesthetic to make him relaxed and ready for us to prepare the area for surgery so that it's clean. He may have already had some pain relief administered prior to this procedure and also the antibiotic if that's indicated. Once he's up on the table, he's induced with the drug through the intravenous catheter. This makes him nice and drowsy so that we can place a tube into his throat, and that allows us to make sure that we can maintain his breathing with oxygen. The anaesthetic agents are then administered through gas into his lungs and enable him to be maintained at a nice level of anaesthesia. Once he's prepared, he will be transferred through to theatre, where our surgeon will be ready with the sterile instruments and making sure that the environment is clean and not contaminated with any dirt, etc. that has been cleaned off Oscar. There is monitoring equipment in this room as well, which enables us to make sure that his pulse and respiratory rates are monitored and that he's in good health at all times. We have trained members of staff that are specifically allocated to monitoring the anaesthetic as backup to these machines and making sure that the vet is fully informed of the level of anaesthesia of the patient on the table. The anaesthetic agents that we use enable speedy recovery of the patients, and that enables them to go home the same day. When you come to Towerwood to collect your pet, the nurse will go through with you if there are any further medications dispensed for pain relief and antibiotics for infections. At this time, further appointments will be made for checkups to make sure that the wounds have healed. On going home, if you have any concerns, re the amount of pain that you may be seeing or concerns re the health of your pet, please phone the surgery at any time.